Hi, I'm Dr. David Dobson. Welcome to Conversations. Today, my guest is Dr. Vivian Oystrick. Vivian is a professor in the Social Service Work program at Cambrian College and a registered social worker with over 2 decades of experience. She holds a PhD in Interdisciplinary Human Studies from Laurentian University. Today, we will be discussing her PhD research, which explored the feasibility and accessibility of art-based mindfulness program for adolescent mothers. It's a pleasure to have you on my show, Vivian.
Thank you, David. Thanks for having me today. It's a pleasure.
Vivian, why were you interested in this topic?
So, just to give you some context about how I ended up studying the feasibility of mindfulness arts-based methods with young mothers, the program that was the focus of my PhD research, the intervention that I studied, was actually developed by Dr. Diana Kohalik of Laurentian University. She's a professor of social work there. She developed this program with her research team in the early 2000s, around 2004. So the program is very well researched. She's published extensively in this area and has found numerous benefits to offering arts-based mindfulness programming to young people, especially young people who have experienced adversity or who experience challenges both at home and at school, either with behaviors or mental health. And when I returned to school to do my master's of social work, I had the opportunity to facilitate in the program for several years. And so I saw firsthand the benefits of this program with young people. I saw how much they enjoyed it. I saw how they developed relationships and how much it helped them with their self-awareness, with their emotion regulation, and their self-esteem. And so I really became passionate about this program. And um, along the way, I started supporting a local program that worked with young mothers, and I was conducting a program evaluation. And in speaking with the young moms there, they had talked about how there are very few programs for young mothers in our community. And if not for this one program, they'd actually have nowhere to turn to for services and support. And so that got me thinking about the possibility of extending what Dr. Kahalik was doing with young people to young parents to see the potential benefits it might have for them. And I got really excited about that. And so that's where the start of my PhD research idea started to form. Yeah.
Wonderful, wonderful. Vivian, for your research, you utilize mindfulness-based interventions and art-based activities. Could you tell us why you chose this specific methodology for adolescent moms?
Yes. So, like I just mentioned, Dr. Kahalik's research has shown that teaching mindfulness concepts, which can be quite abstract, using arts-based methods makes it more accessible, especially for young people. It also makes it less threatening because it's fun and it's contextualized in a creative way. And so sometimes we've seen young people shy away from traditional forms of programming where they're required to talk, right, and engage with
Mm,
adults in a narrative.
mm,
And that can be very
mm,
intimidating.
mm,
And I know from the research that young moms often experience discrimination. And because of that, there is often a lack of trust towards service providers, especially if they're having challenges with their own mental health. And so I thought it would be a nice fit for young mothers who could be invited to come and learn about mindfulness, which we
mm,
know has positive
mm,
benefits for parents, in a way that was fun and not threatening and allowed an alternate expression of feelings, right, through art, which we also know has been beneficial for young moms.
mm,
And so I thought, well, if this methodology is successful with young people and it's also successful with parents, then it's not a far stretch to think that it could be beneficial for young parents.
mm,
So
mm.
that's why I thought it was a good fit.
Excellent. Vivian, in your literature review, I know we all PhD students have to do literature review.
Yes.
You found that art-based activities are effective in helping adolescent moms develop positive interaction with their children. What
Yeah.
specific art-based activities did you find most effective, and how did those activities facilitate this development?
Yeah, so the first step to my research was conducting a fairly extensive scoping review, actually. We
Mm,
did
mm,
search the literature with over 25 electronic databases. I did that search
mm,
twice, and I looked specifically for programs that offered arts-based
mm,
interventions for young parents. And I was also looking for other programs that had taught mindfulness-based interventions. Interestingly enough, I could not find other mindfulness-based programs for
mm,
adolescent mothers that
mm,
had yet been studied or
mm,
published, rather. But I did come across some arts-based programs that were offered to young mothers and young families. And now there was a lot of diversity in terms of what was offered, right? Arts-based
mm,
methods can encompass numerous things from artistic movement to paint
mm,
to drawing to
mm,
clay to
mm,
reflection and journaling,
mm,
creating poetry. So
mm,
there was quite a diversity.
mm,
After reviewing nearly 5,000 articles, we
mm,
included 10 in the scoping review, and even within those 10, there was significant diversity.
mm,
So within the literature, it doesn't really say specifically which ones are more effective. It's really
mm,
about the
mm.
interest and the need of the parent.
Okay.
But I can tell you that Smith Battle, for example, who is
Mm,
quite well researched in this area, did find that certain activities allowed parents, young parents, to express their emotions and
mm,
feelings
mm,
more easily. So,
mm,
in one of their studies, they found that creating bracelets that were
mm,
connected to feelings or
mm,
decorating jewelry boxes allowed young
mm,
moms to express themselves and to
mm,
share more openly than if they were just sitting around and talking.
mm,
There was also another study
mm,
done that looked at cultural activities,
mm,
which really helped young families come together and
mm,
connect with their culture and create bonds with their children
mm.
by incorporating the not only the arts-based activity, but the teaching that went with that. And there were lots of positive outcomes from that as well.
Yeah,
So it isn't so much which art activity, but
yeah.
the process of doing the art. Because even within the holistic arts-based program, there's many different types of
Mm,
artistic expression
yeah.
used.
Vivian, in phase one, your PhD research explored the feasibility of an online art-based mindfulness program for adolescent moms. Can you elaborate on your experience in developing and implementing this online program?
Absolutely. So, my original intent was to conduct the program completely in
Mm,
person, but because of the restrictions around the COVID-19
mm,
pandemic, I couldn't
mm,
conduct face-to-face research with my participants. And so I tried to adapt the program to be offered online so that I can move forward. And I gave it a lot of thought, and a lot of planning went into trying to make it successful. A key part of my ability to implement this was my collaboration with the local organization. I don't
mm,
think I could have actually um, delivered it without their support. They were
mm,
pivotal because they allowed me to not just recruit but connect with the mothers, because they dropped off all of the art supplies to their homes, all of the honorariums and food
mm, mm,
and
mm,
headsets that they
mm,
needed. And so
mm.
we tried to think about all of the barriers that
Yeah.
these young moms might experience
Mm,
from within their homes. And
mm,
it was incredibly challenging because it was the COVID-19 pandemic. People could not leave their homes. And so
mm,
there was other people in the homes. Many of them
mm,
did not have private spaces
mm.
to
Yeah.
engage in the conversation. They had to keep their audio muted. Um, they had a hard time
Mm,
being attentive because of all of the distraction that was
mm,
happening in their home. And so it was particularly challenging. We did manage to offer the program to a small group of moms, and I published a paper on
mm,
on
mm,
the challenges of trying to do so. I made some recommendations there about how to reduce some of the barriers because of limited access to reliable Wi-Fi and
mm.
electronic devices and
Yeah.
private spaces and daycare and
Yeah.
the things that young moms need to actually focus on the program content.
Mm,
So
mm.
yeah.
Very
that's how I ended
interesting.
up. That's how I ended up doing an online program before the in-person program.
Yeah. So I want to talk about the in-person program. So in your phase two, your research explored the feasibility and benefit of an in-person art-based mindfulness program. Could you elaborate on the experience of adolescent mothers who participated in the program?
Yes, so the same program, same structure, same
Okay.
activities, except we had the opportunity once the
Mm,
restrictions were lifted to meet in person. And we
mm,
met at the local organization
mm,
where the moms were familiar with
mm,
the staff, where they were familiar with the environment, and they had trusting relationships. And that was
mm,
really, really important.
mm,
And so the organization helped me connect with the young moms. And what I did right from the beginning is I included the moms in the um, decision making around the
mm,
logistical pieces of the
mhm,
program. So what
mm,
time was best for them, not me,
mm.
right? What time should we have dinner,
Yeah,
right? What do
important.
they need to get
Yeah,
there other than bus tickets? How will they
yeah,
get there?
yeah.
We provided child minding so that
Mm,
someone was looking after
mm,
their children so that they
mm,
could focus on the
mm,
program.
mm,
Um, I even changed the structure a little bit so that it
mm,
was more convenient for them,
mhm.
so they could come in and feed their children
Okay.
and send their children off to the child minding room.
Mm,
And so
mm,
that was, I think, really critical to the success of
mm,
the program. And
mm,
so from there, once we got it off the ground, we met 10 weeks,
mm,
10 to 12 weeks. And each week started with a warm meal and an opening
mm,
activity, an
mm,
icebreaker,
mm,
chatted a little bit about what was going
mm,
on for us during the week. Um,
mm,
I would propose an agenda of what I
mm,
thought we can focus on that night.
mm,
And each session had a particular theme that we focused on. Dr.
mm,
Kaholik's process and program is well published if anyone's interested in looking at it. But each night is focused on a mindfulness-based concept, and the
mm,
activities encourage that the development of those skills around the seven attitudes of mindfulness, so
mm,
self-awareness and non-judgment. And so that would be the conversation for the night, present moment awareness. And
mm,
then we would reflect and share, and every night would end with a closing circle. And we would talk
mm,
about what we liked and what we didn't like and what our
mm,
hopes were for the next week. And so that
mm.
same structure happened every week. It was
Mm,
predictable. And interestingly enough, and
yeah.
this was one of the reasons why I thought arts-based programming would
Mm,
be interesting to young moms, is
mm,
because of the high level of retention and
mm,
acceptability that Dr. Kaholik has found that this program actually encourages,
yeah.
because I did not experience any attrition. I have
Mm,
offered the program twice,
mm,
and I only had one participant have to discontinue because she
mm,
was having her child. And so
mm,
her delivery
mm,
was in the middle of the program offering.
mm,
But typically, and in the literature, it speaks to how challenging it is to engage young
mm,
parents because of how much they have going on in programming. But these moms came every single week.
yeah.
And so it was a really meaningful
Yeah.
experience for me to work with
Wow.
them.
That's pretty amazing. You have all these nine moms who almost like 3 months coming to this program. That's pretty nice.
Yeah. And interestingly enough,
Yeah.
several of them asked to take the program again.
Oh
And
wow.
we originally intended to offer it for 8 weeks, and they
Mm,
asked if we could continue.
mm,
And they wanted me to continue with the program. So I extended it as long
yeah.
as I could, but at some
Yeah.
point we had to
Yeah.
wrap up. But
Because having so much fun.
yeah.
Vivian, your research concluded that art-based mindfulness programs are effective in intervention for the adolescent moms. Could you elaborate on what you found to be the most significant benefits?
Yeah. So again, there were many benefits that the
Mm,
moms expressed, but I think the top three that I think were
mm,
most beneficial um, included their ability to connect with others. That was one of the
yeah.
themes that came out of um, my analysis, was their ability to socialize and connect. And it was really, really important and critical for these young moms, especially in the context of the pandemic, to be able to get out, because a lot of them said that they hadn't been out of their homes for months. They didn't have any friends. And
Mm,
if not for this one program, they would be feeling quite isolated. And so socializing and developing relationships meant more than just acquiring friendships. It
Mm,
actually meant gaining social capital. And so what I saw happening was moms sharing resources, moms supporting one another by babysitting each other's kids, moms going to each other's birthday parties for their
yeah,
children and themselves,
yeah.
sharing diapers and changing clothes when their kids
Mm,
outgrew them,
mm,
and um, sharing transportation. And so that was really powerful because
mm,
a lot of those moms are still connected and remain connected after the program. And so
mm,
it encourages that sense of belonging and
yeah,
reduces the social isolation, which a lot of
yeah,
young moms feel because when they become pregnant,
yeah,
often their family and their
yeah,
core friend group
yeah.
leave because they're upset or they can't relate to them anymore.
Mm,
Right.
yeah.
Secondly, was they expressed, they learned new ways to cope. A lot of them learned that they enjoyed art. They were going to continue to
Mm,
do art.
mm,
They learned how to regulate their emotions. They learned about mindful walking. They
mm,
learned how to do body scans and how to cope with the daily stressors. And we know that young moms experience high levels of stress compared to older mothers. And so this was really important. And
mm,
the keepsakes that they took from the program were reminders of their coping. And so they said they kept them around their homes. And if they were having a hard day, they would see the poem or they would see the art piece, and it would remind them that they were able to move forward, that they had the skills to do this.
yeah.
And so that was another theme that came from all of the moms said that they kept all of their art pieces as reminders of how to cope more effectively.
Mm,
And
excellent.
lastly, and I think this speaks to really to the mindfulness piece and the mindful parenting piece, is a lot of them said that they really developed a stronger sense of present moment awareness and self-awareness. So they were more in tune with their children. We know from the research that young moms are very task focused. They have a lot of pressure
Yeah.
from society, from professionals to get everything done. They're juggling school and work and multiple responsibilities, and they feel like in a lot of cases the world's against them because they have to prove themselves. So they're very task focused, right?
Yeah.
So learning these skills allowed them to refocus. And several of them said like they would take moments to stop through the day and instead of thinking about the next thing they had to do, whether it was clean the house or get groceries, and really focus on the activity that they were doing with their children
Mm,
and to walk mindfully instead of just going for a walk. And
mm,
one mom talked about buying a box of popsicles, and instead of just eating them, they talked about what they tasted like and the different flavors
ah,
like. And so really integrating that mindfulness and
yeah.
thinking about how am I responding to my
Mm,
child right now, and how am I feeling and how is that impacting my parenting? And so
mm,
that was really exciting for being here because that was what I really was hoping that they were going to get from the program was, that knowledge and the ability to just stop and take time for
mm,
themselves and their kids and really focus on that relationship, rather than all the other things that they had to do. And so for me, those are the top three benefits, I think. The connection with other people, learning how to cope in a positive way, and improving that awareness.
wonderful. So, Vivian, based on your research, um, what are the most significant changes you would recommend to current service delivery and care models for adolescent mothers?
Well, I think there's many, but I think we need to prioritize holistic
Mm,
care. Many
mm,
of the programs that currently exist for adolescent mothers are focused on perinatal health and parenting education,
mm,
improving parenting skills. There's this assumption that we need to teach young moms how to parent properly, right?
mm, mm,
When a lot of them know how to parent and they're very good
mm,
parents.
mm,
What we sometimes miss is the mental health aspect because we're so
mm,
focused on teaching young moms how to parent and
mm,
making sure that the baby's gaining weight and
mm,
the baby's eating and sleeping. All those things are very important. I don't want
yeah.
to, you know, um, dismiss those, but I think organizations that offer programs that specifically measure health outcomes need to think about ways to incorporate other
Mm,
programs like arts-based mindfulness programs into their service models so that moms have an opportunity to connect with other mothers, to learn how to focus on their own mental health, their own care, and their
mm,
own way of coping, right? I
mm,
had a young mom say, the nurse comes in and says,
mm,
does the baby weigh what the
mm,
baby's supposed to weigh, asks me a bunch of questions and
mm,
leaves. And she
mm,
says, nobody
yeah.
asks if I'm okay. And that was really profound. So I think There are only a couple of organizations in Ontario that actually offer that holistic care where mom and baby can receive care at the same time in the same place to
Mm,
break down barriers and to make it more accessible. So I think we need to start thinking more holistically and creating circles of care that are easier for moms to access.
yeah,
Yeah,
yeah, so important.
it is.
Vivian, what advice to future researchers to continue this type of research?
Yeah, so I think it's incredibly important, especially since I found that engagement, retention, and
Mm, mm,
accessibility and feasibility was quite high, which tells me that if the program is replicated, that
mm,
you may have favorable results. And so, for researchers who are interested in doing this work, I think my biggest recommendation, the most important aspect of my research was the collaboration with
mm,
organizations because it breaks down barriers to accessing the
mm,
population because sometimes
mm,
young parents are considered hard to reach in the
mm,
literature. So it gives you access, but not only that,
mm,
it helps you develop the trusting relationship that is required. Um, I think that, and I wrote in my thesis that the success of the program with young moms was not just because of how wonderful the program is, but was just as
mm,
important. Just as important was the relationship that those young moms had with my collaborating organization,
mm,
the trust that was already there because they allowed me in to be able to deliver the program. And if that trust wasn't there, we never would have got off the ground because I wouldn't have anybody in the room. And so, because the organization was able to say, we trust Vivian and we trust Vivian to come in here and do this
mm,
work, they
mm,
were more open to that. And I saw a real change in how the moms engaged with me over
mm,
time and started to
mm.
trust
Yeah,
who I was and what I was doing.
yeah,
And so, collaborating
yeah,
and trying to break down those barriers as much as possible, like
yeah,
providing
yeah,
bus tickets and food
yeah.
and childcare.
Mm,
Childcare is critical
mm,
because
yeah,
otherwise they can't focus
yeah.
on the program
Mm,
content. And so
mm, mm,
we, as researchers, can't rush into um, this type of work.
yeah.
There needs to be a lot of
Mm,
work done before the research
yeah.
to create the proper context and also to collaborate with the moms where possible, right?
Mm,
Again,
mm,
if I went in and said I'm offering this program at 11 o'clock in the morning because that's when I'm available, I
yeah,
wouldn't have had anybody there. Like they said to me,
yeah,
Vivian, our kids
yeah,
sleep at 1 o'clock in the afternoon.
yeah,
It has to be at 3.
yeah,
So that's when I did it was at 3.
yeah.
And and another important aspect is showing up. And over a 2-year period, I did not miss a single session. And that helped to develop the relationships because they knew I was going to be there. So
Mm,
they came. And if I
mm,
didn't show up, then they weren't going to. And so I think consistency,
yeah,
um, relationship building, trust
yeah,
building, collaboration,
yeah.
really putting in the time.
Mm,
And it's challenging, especially for researchers who, like me, are mothers as
mm,
well,
mm,
balancing that proximity
mm.
and distance in qualitative
Yeah,
research, um,
yeah,
developing relationships, but still being able to maintain professional and ethical
yeah,
distance and getting comfortable in that place
yeah.
of like, developing trust, but still
Mm,
being able to practice in an ethical and
yeah.
professional. So.
Yeah, objectivity in the same time.
Yeah, and the things that they share are
Yeah, yeah,
deeply personal and
yeah,
emotionally
yeah.
um, can be emotionally heavy, and
Yeah.
um,
Mm,
it's it's sometimes challenging to
mm,
compartmentalize that as a
yeah,
researcher and
yeah,
not want to do more.
yeah,
But
yeah,
remembering that, it is a research program, but you do
yeah,
still have to develop that trust and relationship and be seen
yeah,
as a human being,
yeah.
not just a researcher.
Vivian, looking ahead, what's next for you?
Um, Well, I'm continuing my research in the benefits of arts-based programming. I'm um, not involved with the Holistic Arts Praise program anymore, but I'm currently researching the benefits of socially engaged arts-based community programming for people living in high priority neighborhoods in Sudbury. We were fortunate enough at Cambrian to receive funding from NSERC and Canadian Council for the Arts. So again, I'm collaborating with a local art organization, Myths and Mirrors, that have been around for 20 years. They're an incredible organization. Lucky to have this partnership, and we're working with people who live in neighborhoods in Sudbury where they don't have access to programming. And we're looking at the benefits of bringing people together to participate in arts-based activities and what that means for them in terms of their personal and community level resilience. And although the analysis isn't complete, we're certainly seeing some, positive preliminary findings just in speaking with the people who completed the first cohort. And so I've been working on that primarily for the past year, and I have another year or so left to go. So arts-based program is something I'm very passionate about, and I think is very versatile and can be applied to many different populations. Yeah, so I will continue that work.
Thank you so much for joining me today, Vivian. I wish you all the best with your work.
Thank you. Well, thank you for having me, David. I
Yeah.
love talking about
Yeah.
this work, and I appreciate the opportunity to
Yeah.
speak about it.